Okay. Now, leaving the realm of dementia and depression, just talking about depression in elders, there are a number of factors to consider, and probably, top of the list is you have marked change in liver functioning. You remember, after about the age of 60 or 65, in normal, healthy adult elders, you start having a dramatic decrease in the metabolic rate in the liver. So what this means is when you use drugs, including antidepressant drugs, they're not going to metabolize it the way a 40-year-old would. And so if you gave them normal starting doses of a drug, what's going to happen? Their blood levels are going to be way too high, and they're going to get side effects or even may get some toxicity. Also, kidney functioning can be impaired, either by disease or by aging. And so the old rule then is start low and go slow, meaning the going slow means to gradually increase the dose. And most elders are going to probably benefit from therapeutic doses that are half of what it would take to treat a middle-aged person. Okay? Side effect sensitivity. Okay. Well, this becomes a bigger deal with older people. Anticholinergic side effects. Benadryl, which is an antihistamine, obviously, is frequently used by older people as a sleeping aid. They may never tell their doctor about it if they're using it, but Benadryl, in addition to being an antihistamine, has very significant anticholinergic effects. And if you have somebody that has a brain injury, like somebody's had head trauma, or they've had a history of encephalitis, or they've had a history of strokes, or whatever reason their brain is damaged, or you get somebody over the age of 60 or 65, they're simply going to be more susceptible to central anticholinergic effects, okay? Now, again, you have central, meaning central nervous system, and it's mainly memory problems, but you could have frank delirium, and a person can be hallucinating and grossly disoriented and that kind of stuff because of anticholinergic effects. So Benadryl, over-the-counter, it's also the ingredient in, like Tylenol PM, for instance, has a significant amount of Benadryl in it. All right. Paxil is really the only more or less new antidepressant that has anticholinergic effects and really just shouldn't be used with older people. There's no reason to use it. It has interactions with other drugs and that sort of thing, so they're safer drugs to use. Some people are being treated with Elavil. Now, Elavil may be the best of these antidepressants for treating pain that we talked about before. It seems to be better than some of the newer generation. So it really does have a place in treating chronic pain. It's also got a lot of sedation, so many people will give it to the patient. They'll take it at nighttime, and it controls pain, but also helps them go to sleep. But it's got a significant amount of anticholinergic effects. Okay, so again, you can get delirium, you can get constipation, and so forth. And people that are on some antipsychotics, and they still use Haldol, in a number of nursing homes, will develop side effects, and they'll treat that with anticholinergic drugs like Cogentin, for instance. And so, in other words, there are sources of anticholinergic actions that can really cause havoc. Constipation, you know what? Constipation can kill you. And that may seem bizarre, but you can get bowel obstruction, okay? And especially in a person who has dementia, and they can't articulate, what they're feeling, and you can get a ruptured bowel and then get infection, and that can kill you. Urinary retention can be not only very painful, but also the infection itself can cause a delirium, okay? Aggravates glaucoma, memory problems, so forth. So really being very watchful about staying away from drugs that have anticholinergic side effects. Okay, sedation. Sometimes this is helpful, okay? This is especially true if you have somebody who's got severe depression. We're going to see that Remeron actually can be quite helpful, but if there's too much, then it can cause too much drowsiness. And again, in lots of nursing facilities, it's all about behavioral control rather than actually trying to treat the patient. let me mention one thing about trazodone. Let me see if I've got a separate slide on that. Hang on just a second. Oh yeah, I do. I've got a separate slide, so we'll get to that here in just a minute. Okay, extrapyramidal side effects. We've already talked about those. In the newer antipsychotics, Risperdal is the one that has the most. Not a lot, but it has some. But also, you can get some, especially akathisia, that restlessness, with SSRIs on occasion. Okay, this is what causes restless leg syndrome. People that chronically take SSRIs, it's got to be watchful. It can aggravate Parkinsonian symptoms and so forth. Okay, what else? Cardiac problems. Okay, orthostatic hypotension. If you load up somebody with antipsychotics, they may have trouble with this. Probably more commonly is a problem with trazodone. And you may remember from an earlier class, this is the most widely prescribed sleeping medicine in the United States. Okay? And with trazodone, if you stand up too quickly, you can get dizzy. Orthostatic hypotension doesn't regulate blood pressure when you're making postural changes, and people can get dizzy and fall. And with more fragile skeletal systems, and that becomes a real problem. I really think trazodone should not be used in elders for that particular reason. The flip side of this are increases in blood pressure. And really, among the new generation antidepressants, there's two that do this, Effexor, and Prestique is actually a metabolite of Effexor. I haven't seen any data on the frequency of increases in blood pressure. For most people, this is not a big deal, but somebody that has hypertension, this can aggravate the issue. Okay? I mean, I think you can see that you just are sort of multiplying potential problems because of much more health problems you see in elders. We talked about serotonin reuptake inhibitors causing activation. Obviously, they can do that in elders just like they can anybody else. And drug-drug interactions. Going back to our very first class, now this becomes enormously important because most elders are taking several, if not many more, prescription medications, and the potential for drug interactions are certainly there. It can happen with a lot of the antidepressants. Prozac, Paxil are probably top of the list, and they're affecting that particular enzyme, 2D6, which really can then interfere with the metabolism of pain medications. St. John's wort, as I mentioned in earlier class, has multiple effects. It increases some enzymes, it inhibits some enzymes. And so really, for older people, St. John's wort, you should just stay away from it because you start getting, you get two drugs and you can kind of predict what their interactions are going to be, but you start adding a third drug and it gets awfully difficult, and a fourth drug and a fifth drug, and most pharmacists will say, who knows? Okay, so this is something, though, that sometimes people will take these over-the-counter drugs and not tell anybody about that. And Celexa and Lexapro have virtually no drug interaction problems. So for this reason, there's good reason to choose those medications to treat depression if the person is taking a number of other prescription medications. Some general issues here, forgetting about taking medications. Lots of people forget, but a lot of people who are older having memory problems forget that they forgot. Right? And so what will happen is either they'll forget to take them, or on the other side, they may think, well, I don't think I took that, and they'll take it and they'll end up getting too many. So, one thing that actually I found to be very helpful for people who forget, this is true for anybody, but probably more so with elders, is if they take their antidepressant once a day, but they often forget to even take it, is to get a small bottle and put pills in it and tape it to your toothbrush. And that is every morning when you go to brush your teeth, and you know, oh yeah, I need to take my antidepressant. It works, okay? Sharing medicines. You think that ever happens? Oh, I got some of these left over. My husband used to take these for his heart condition here, why don't you take some?